The Tri-Service General Hospital, the former Shanghai Jiangwan General Hospital, was established in 1946 when the ROC military took over Xiaonanmen Ward of Taipei and turned it into the Taiwan Army Hospital. In 1968, the 801 Army General Hospital was reorganized into the Tri-Service General Hospital, which then moved from its original location at Xiaonanmen to Camp Shuirandi, the well-known Dingzhou branch of the hospital. With the rapid changes in the medical environment and nearly 50 years since its establishment, the hospital's Dingzhou branch was operating well over capacity. To improve and develop military medical education and its overall medical operations, the Dingzhou branch was moved from Dingzhou Road to Neihu in 2000. Located at the junction of Taipei's Chenggang Road and Minquan East Road and adjacent to the Zhongshan Highway, the hospital's brand new Neihu branch commands a very convenient traffic network. The main building stands 7 floors high with another 2 floors below ground. This is an aerial view of the entire medical center, which covers 43 hectares, accommodates more than 1,800 beds and 3,000 employees, and provides service to a daily average demand of 6,000 outpatients. To facilitate convenient medical treatment, electric shuttle buses are available outside the main gate, to the right, for those who need transportation. In addition, 13 bus routes travel around the hospital. There are also more than 900 designated parking spaces. The hospital services military servicemen on active duty, their families, and the general public. The scope of its services covers outpatients, emergencies, inpatients, and patients requiring other medical assistance. There are 52 medical departments, including internal medicine, surgery, gynecology and obstetrics, and pediatrics. The hospital is a teaching hospital under the jurisdiction of the National Defense Medical Center. It is also the only military hospital on the level of a medical center, hence playing a significant role in the national medical care system. In peacetime, the hospital provides health services for the public and clinical training and internships for students of the National Defense Medical Center. In wartime, it mobilizes support and integrates control of medical resources. Prevention of epidemics, disaster relief, and emergency medical care are some of the core responsibilities of military medicine. The hospital always steps in instantly to provide rescue in the event of major disasters such as SARS, the 9/21 earthquake, and the flooding in the wake of Typhoon Morakot. Disaster relief endeavors also reach countries such as Haiti during a major earthquake. The hospital has visited Burkina Faso, Indonesia, Cambodia, as well as other diplomatic allies to provide telemedicine services and train local medical staff. The International Cooperation and Development Fund has awarded the hospital a certificate of appreciation in recognition of its contribution. The whole world has also witnessed the achievements our medical service members have made in the field of military medicine. The hospital is developing minimally invasive surgery and has cooperated with the National Taiwan University of Science and Technology in the R&D of a next-generation minimally invasive surgical training system. Since its first successful live donor kidney transplant in 1986, the hospital's transplant team has continuously worked hard and made a number of breakthroughs in transplantation technology. For example, Dr. Cai Jian-song of the Department of Surgery was lauded by society and academic circles for performing the first successful heart transplant in Asia to treat dextrocardiositis inversus totalis in 2013. Committed to drills and training aimed to treat radiation injuries, the hospital is tasked by the Ministry of Health and Welfare to provide emergency care for Category 3 nuclear accidents, the only organization designated to provide model medical treatment drills for nuclear accidents. It shoulders the responsibility of safeguarding the military and civilians of Taiwan as the final line of defense against radiation injuries. The hospital has always been assessed as a teaching hospital on the level of a medical center by the Ministry of Health and Welfare and has remained the general public's health guardian. The hospital's core values are compassion, quality, discipline, and innovation. Compassion. The interior of the hospital features human-oriented design with plenty of natural light and a beautiful view. It also provides various thoughtful services and measures. The Women's Health Center provides a one-stop multiple screenings walk-in service for women and enhances privacy and convenience during their visits. Hospice wards provide a cozy atmosphere. The hospital's prayer rooms, featuring different religions, help to provide patients with spiritual solace. In the first floor ambulatory area, there are multiple channels for making appointments and registration. The hospital outpatient pharmacy offers professional and comprehensive multimedia medication inquiry system and a room for medication consulting. Nurses with professional medical knowledge are available at the medical consultation room to answer people's questions. The hospital has supplementary cashier counters available to shorten people's waiting time. To assist mobility-challenged patients and the elderly, the hospital has a priority counter for them to receive medicine. An enlarged schedule for ambulatory care and a Braille edition are also available for the elderly and the blind. To better serve foreign patients, the hospital has designated specialists to assist them in making appointments and walk them through the entire treatment process. The Excellent Bilingual Living Environment Initiative, promoted by the Research Development and Evaluation Commission of the Executive Yuan, ensures convenience for foreign patients. The Facebook Automatic Bookstop on the second floor is the first such initiative among hospitals nationwide. Being thoughtful of patients seeking treatment, the hospital has provided touching services by regularly holding tea-serving events for outpatients, setting up iTaiwan wireless network for the public to surf the internet at their convenience, and arranging musical performances to soothe the patients. With Yuanyuan volunteers providing thoughtful services in a loving, passionate way, the hospital was lauded by Common Health magazine as the friendliest hospital. The hospital has been committed to serving the people by appealing to communities, aiming to become a health guardian for communities. It has also worked with community groups in Nangang, Nehu, and Shizhi, organizing health talks and community health service stations, and thus binding hospital services tightly with community development. The hospital also extends its care for remote villages by providing medical services to Smangus in Jianshi Township, Hsinchu County. Quality. To uphold the quality of medical care, the hospital carries out health examination and employs the most advanced medical equipment, including the positron emission tomography center, MRI system, 256-slice CT scanners, a three-dimensional neuronavigation system for intracranial surgery, Da Vinci surgical systems, and hyperbaric chamber systems to ensure the most appropriate treatment results. The hospital is a national-level medical center that conducts a full range of organ transplants. In remembrance and appreciation of the organ donors over the years, the hospital has dedicated an Immortal Life Memorial Park to them for the everlasting love bequeathed, which makes their lives eternal. Facing the upcoming new era with an aging population, the hospital has set up demonstration wards for the elderly and provided a holistic clinic. It has set up a medical quality and patient safety committee to establish and identify monitoring indicators and measures. The hospital has attached great importance to preventing inpatients from falling and has tiled the floor with non-slip tiles. Patients undergoing surgery are identified correctly beforehand, and timeout verification is performed beforehand. The hospital has implemented the 5 rights and triple check executing process and the setup of various precautionary measures in the physician order system so as to ensure patient safety. The hospital's high quality of medical treatment has been well recognized and awarded the Golden Thumb Award, Excellence in Health Promotion Award, and Friendly Workplace Award by the Executive Yuan. It was rated as the first runner-up in the medical institution category in a survey conducted by Global Views magazine. The hospital has put a lot of effort into specialized medical R&D and new technology. As a result, it has been awarded the National Biotechnology Award and the Innovation Award on a yearly basis for development and applications of gene delivery targeted drugs, skin tissue engineering, tibial, bone plate, and bone screw systems. It was also commended by the Presidential Office in recognition of such achievements. Discipline. To develop the core characteristics of military medicine, and meet the special mission needs of the military forces, the Combat and Disaster Casualty Care Training Center, Hyperbaric Center, Burn Center, and Nuclear Radiation Prevention Center were established. In observance of national policy guidance, the hospital regularly provides emergency medical support to the military and civil society during various exercises to bring its medical professional competence into full play. In conjunction with hospitals responsible for regional emergency medical care and other military hospitals, we have organized training courses for advanced emergency medical technicians, including high mountain disaster and CPR training. We provide emergency medical services in the grassroots military units to develop and train talented personnel. The hospital has been labeled as excellent in accordance with the new accreditation system and passed the qualification assessment for teaching hospitals as a medical center. It also has been assessed by the Ministry of Health and Welfare as a teaching hospital for objective structured clinical examination. Every year, it spares no effort to provide training on clinical skills and simulation, and has cultivated a lot of outstanding medical talent since its establishment. To embrace the e-hospital era, the app Doctor Visit Manager enables online registration from mobile devices and provides real-time status of the clinic progress upon inquiry. The hospital also created a mobile medical imaging system by which doctors can instantly explain to patients their conditions at their bedside. The specimen barcode tracking system has reduced missing and returned sample cases. In compliance with Ministry of Health and Welfare policy, the hospital has also established a PACS medical imaging and storage system, electronic medical records, and cloud data center. The hospital's medical staff can therefore have access to medical records and reports anytime, anywhere without using paper. Innovation. To advance clinical research training, the hospital continues to build a high-quality environment favorable for research. It has established the Institutional Review Board and General Clinical Research Center for New Drug Trial and engaged in alliance between medicine and industries, as well as inter-hospital research cooperation. The hospital has an instrument center, core laboratory, and laboratories serving various kinds of research. Its internationally certified Laboratory Animal Center has a variety of genetically modified, genetic knockout, and pure-line laboratory animals for a broad range of medical research. It is the best validation and trial center for laboratory animal models prior to clinical trials. The Dingzhou branch continues to provide health services to people with retained ambulatory and emergency care. Following national policy, the hospital took over Penghu, Jilong, Songshan, Beitou, and Taipei Outpatient Center branches to provide the highest quality of medical services. From now on, the hospital will uphold its core values: compassion, quality, discipline, and innovation, in the spirit of inheriting the past and ushering in the future to promote humanity, improve the quality of medical care, solidify education and training, innovate research and development, and excel in military medicine so as to fulfill the mission of safeguarding physical and mental health of the military and civilians of the country. With its new look and modern medical facilities, it will provide wholehearted service and holistic care to realize its aspirations of becoming the optimal choice for the military and civilians seeking medical care. A health guardian for community residents and an international level national defense medical center.